Did you know that your body might be trying to warn you about heart failure? But most people miss these important signals until it's too late. Every day, thousands of Americans over 60 find out they have heart failure only after serious damage has already happened. But what if you could notice these warning signs just by looking in the mirror? In this video, I'll show you 6 appearance signs that doctors right away know as warnings of heart failure. These are signs that you can notice today that could actually save your life. Let me tell you about Thomas, a 67-year-old former teacher from Ohio. For months, he'd seen strange changes in how he looked. His nails looked different, and his skin had an odd color. But he brushed these off as just normal getting older. That's just what happens when you get older, he'd tell his daughter whenever she worried. Then one day during a regular haircut, his barber saw something scary and told him to see a doctor right away. When Thomas finally went to his heart doctor, the doctor took one look at him and asked for tests immediately. The finding was severe heart failure. These signs have been showing for months, his doctor said. Without help, you likely had less than a year left. Today, thanks to seeing these signs and getting proper care, Thomas is doing well. In the next few minutes, I'll share exactly what his doctor saw before it's too late for you. Let's start with the first sign doctors right away know. Sign 1 is strange nail changes. Have you looked closely at your fingernails lately? Have you seen any changes in their shape, feel, or color? These small changes might be your body's urgent attempt to warn you about your failing heart. Heart doctors at the American Heart Association say that nail changes are one of the earliest visible signs of poor blood flow caused by a failing heart. When your heart isn't pumping well, oxygen-rich blood doesn't reach your far body parts properly. Your nails are often the first place to show it. Dr. Jennifer Hay, a top heart failure expert at Columbia University Medical Center, says, the nails can act as a window to your heart health. Changes here often come before more clear symptoms by months or even years. Take the case of Doris, a 71-year-old from Nebraska. She saw her nails becoming more breakable and starting to curve downward like tiny spoons. She thought it was just another sign of aging until her daughter, a nurse, knew these changes as possible clubbing. This is a classic sign of heart and lung problems. When Doris finally saw her doctor, tests showed her heart was working at less than 40% ability. If you hadn't come in when you did, her doctor told her, we might have been having a very different talk in just a few months. Here's what you need to do right now. Look at your nails today. Are they getting a bluish color? This could show poor oxygen flow. Have they started curving downward at the tips, making a rounded look like tiny spoons? This clubbing is a serious warning sign. Have they become very breakable or grown ridges? These could all be your body's urgent attempts to tell you about heart problems. If you see any of these changes, don't wait until your next planned visit. Call your doctor today and clearly mention these nail changes. Time is very important when it comes to heart failure. Catching it early can mean the difference between a simple medicine change and major heart surgery. Is waiting another day worth the risk? Sign 2 is strange hair loss or feel changes. The way your hair looks and feels can show dangerous heart problems long before chest pain or trouble breathing ever starts. Are you seeing more hair in your brush? Has your hair suddenly become dry, breakable, or changed feel? Your heart might be sending you urgent warnings. Research in the Journal of Heart Medicine shows that less blood flow from a failing heart often affects the hair roots first. This causes clear changes months before more serious symptoms appear. Dr. Richard Sander, head of heart disease prevention at Jefferson University Hospital, says, hair roots are very sensitive to less blood flow. When the heart struggles to pump well, nutrient delivery to the roots gets less. This often causes visible changes to hair quality, feel, and keeping. Think about what happened to Lawrence, a 73-year-old former accountant from Minnesota. He'd always had a full head of hair, but over just 3 months, he saw it getting thin quickly and becoming very dry and breakable. His wife said it was just normal aging. But when he mentioned it during a checkup, his doctor right away asked for heart tests. The results showed Lawrence's heart was only working at 35% ability. Your hair was trying to tell you something, his heart doctor said. If we hadn't caught this now, you would have been in the emergency room within months. Here's what you must do today. Run your fingers through your hair right now. Is it coming out more easily than before? Has the feel changed suddenly from smooth to breakable? Is there a strange pattern of loss appearing? These aren't just looks concerns. They could be life-saving warnings. If you see these changes, take a clear photo of your hair, especially areas of thinning. Make a visit with your doctor this week. Clearly mention the sudden changes and ask about possible connections to heart health. Don't wait for more serious symptoms to appear. By then, big damage may have already happened. Remember, catching heart failure early means simpler treatment and better results. Why risk waiting even one more day? Sign 3 is swelling in specific face areas. Has your face started to look puffy or swollen, especially in the morning? Do your cheeks or the area around your eyes look different in the mirror? This could be one of the most missed signs of heart failure that doctors right away know. Heart experts at the Mayo Clinic warn that fluid keeping from a weakening heart often shows up first in the face, especially around the eyes and jaw. This happens because when your heart can't pump well, fluid backs up throughout your body. Gravity causes it to collect in the lowest places while you're lying down, including your face when you sleep. Dr. 𝐎𝐥𝐝𝐲, Chief Science and Medical Officer of the American Heart Association, says, morning face puffiness, especially around the eyes, can be one of the earliest visible signs of fluid keeping related to heart failure. Take the case of Harriet, a 69-year-old former librarian from Wisconsin. For months, she saw her face looking more and more puffy in the morning. She tried changing her pillows, cutting salt, and even expensive creams. She thought it was just part of aging. At her daughter's wedding, a relative who hadn't seen her in years commented on how her face had changed. When Harriet finally mentioned this to her doctor, tests showed moderate heart failure that had been growing silently for months. Those changes in your face weren't aging, her doctor told her. That was your body's way of warning you that your heart wasn't keeping up. Here's what you need to do tomorrow morning. Right after waking up, look closely at your face in the mirror. Pay special attention to the area around your eyes, your cheeks, and your jawline. Is there clear puffiness that wasn't there years ago? Does it get better throughout the day as you are upright? Take a photo first thing in the morning and another in the evening to compare. If you see lasting morning face swelling, especially if it gets better when you're upright during the day, call your doctor this week. Clearly mention the pattern of swelling and ask about heart-related fluid keeping. Don't wait for more dramatic symptoms. Early help can prevent unchangeable heart damage. Is your appearance telling you something your body urgently needs you to hear? Sign 4 is visible skin color changes, the sign everyone can see. The color of your skin might be broadcasting your heart health to everyone around you. Even strangers can often spot this warning sign before you notice it yourself. This isn't about normal aging, it's about specific color changes that signal dangerous heart failure. Harvard Medical School researchers have written that specific skin color changes are so strongly linked to heart failure that experienced doctors can often diagnose patients just by looking at them. When your heart isn't pumping well, oxygen-rich blood doesn't reach your skin properly. This causes subtle but clear color changes. Dr. Andrew Waxler, heart doctor and member of the American College of Heart Medicine, says, the skin is basically a canvas that reflects what's happening with blood flow. Certain color changes, especially around the lips, nail beds, and earlobes, can be immediate red flags for heart failure. Think about Bradley, a 75-year-old former construction worker from Arizona. He had always been active and healthy, but his barber of 20 years saw something worrying during a regular haircut. There was a bluish color to Bradley's lips and a grayish cast to his skin that hadn't been there before. You need to see a doctor, his barber insisted. Something's not right with your color. When Bradley finally went in for a checkup, his doctor right away asked for heart tests. The finding was congestive heart failure that needed immediate help. Your barber may have saved your life, his heart doctor told him. These color changes have probably been growing for months. Here's what you need to do right now. Look at your skin in natural lighting, especially your lips, the inside of your lower eyelids, and your fingertips. Do your lips have a bluish or purplish color rather than healthy pink? Does your skin have a grayish cast? Is there a yellowish color to the whites of your eyes, or a pale appearance to areas that should be pink, like your gums or the inside of your lower eyelids? If you see any of these color changes, take a clear photo in natural lighting and see your doctor within 24 hours. These aren't looks concerns. They're possibly urgent warnings of poor blood flow from a failing heart. Tell your doctor clearly about the color changes you've seen. Remember, the earlier heart failure is caught, the more treatment choices you have. Don't wait for chest pain or trouble breathing. By then, big damage has often already happened. Sign 5 is changes in ear appearance. When was the last time you really looked at your ears in the mirror? Most people never check this area, yet it could be showing one of the most scientifically proven signs of heart problems that doctors right away know. According to research in the American Journal of Heart Medicine, specific changes to earlobe appearance strongly connect with coronary artery disease and heart failure. In fact, this connection is so well known in medical literature that it has its own name, Frank sign. Dr. Elizabeth Jackson, professor of heart medicine at the University of Alabama, says, a diagonal crease in the earlobe has been repeatedly shown in studies to have a big association with coronary artery disease. It's something heart doctors always notice, but patients rarely do. Look at Gregory, a 72-year-old former teacher from Pennsylvania who went for a regular checkup. During the exam, his doctor saw diagonal creases across Gregory's earlobes. Though Gregory had no symptoms and felt fine, his doctor right away asked for heart tests based on this single observation. The results showed severe blockages in 3 major coronary arteries. This condition is known as triple vessel disease that often leads to heart failure. I had no idea my ears were trying to warn me, Gregory said later. I felt perfectly normal, but according to my heart doctor, I was at high risk for a major heart attack within months. Here's what you must do today. Find a well-lit mirror and really look at your earlobes. Do you see a diagonal crease running across either or both of them? This isn't a normal aging change. It's possibly a critical warning sign. Also check for strange thickening of the earlobe tissue or changes in earlobe shape. If you see these ear changes, don't wait. Take clear close-up photos of your ears and make a visit with your doctor this week. Clearly mention the earlobe creases and ask about their connection to heart health. These simple observations could actually save your life by catching heart disease before it progresses to advanced heart failure. Isn't a quick look in the mirror worth that peace of mind? Sign 6 is unexpected dental and mouth changes. Your mouth could be showing the first signs of heart failure long before you feel chest pain or trouble breathing. These changes often go unnoticed or are dismissed as normal aging. But doctors and dentists right away know them as possible warning signs of heart problems. Dental researchers at the University of Pennsylvania have found clear links between certain mouth changes and heart disease. When your heart isn't pumping well, it affects blood flow to your gums and mouth tissues. This causes visible changes that research now shows often come before other heart failure symptoms. Dr. Lisa Stevens, director of the Heart-Mouth Health Connection Research Program, says the mouth can serve as an early warning system for heart problems. Changes in gum appearance, strange tooth looseness, or lasting bad breath that doesn't respond to normal mouth cleaning can all be red flags for poor blood flow related to heart failure. Think about Vincent, a 70-year-old former postal worker from Florida. He saw his gums bleeding more easily and had developed lasting bad breath despite careful brushing and flossing. His teeth had also become more sensitive without explanation. Vincent thought these were just normal aging changes until his dentist became worried during a regular checkup and suggested he see his physician. When Vincent finally saw his doctor and mentioned these mouth symptoms, tests showed early-stage heart failure. Your mouth was telling us your heart was struggling, his heart doctor said. Most people wouldn't connect these symptoms, but they're actually closely linked. Here's what you need to do right away. Look at your mouth carefully today. Are your gums pulling back more than before or appearing purplish rather than healthy pink? Do your teeth feel looser or have you developed strange sensitivity? Has lasting bad breath appeared despite good mouth cleaning? Look at your tongue. Has it developed a whitish coating or strange feel? If you see any of these changes, make a visit with both your dentist and your doctor this week. Tell them clearly about the mouth changes you've seen and ask about possible connections to heart health. Many patients report that their dental problems were the earliest sign of heart failure. This is one that could have led to earlier finding if known properly. Don't dismiss these changes as just getting older. They could be your body's urgent attempt to warn you about your heart. Now that you know these 6 critical signs, you have the power to possibly save your own life by catching heart failure before it progresses to dangerous levels. From nail changes in hair feel to face swelling, skin color, earlobe creases, and mouth health, your body has many ways of alerting you to heart problems long before more clear symptoms appear. The key is paying attention to these subtle changes and taking immediate action. Heart failure doesn't have to be a death sentence. Caught early, it can often be effectively managed with medicines, lifestyle changes, and proper medical care. But you must know these warning signs and act quickly. If you've seen any of these 6 signs while watching this video, don't delay. Contact your doctor right away and clearly mention these observations. Your proactive attention to these subtle but critical changes could mean the difference between a simple treatment plan and a life-threatening emergency. Don't wait until it's too late. Check for these signs today. If you found this information valuable, please hit the like button right now and subscribe to our channel for more possibly life-saving health information. Comment below which sign surprised you the most, or if you've seen any of these changes in yourself or a loved one. Share this video with friends and family over 60. What you've learned today could actually save someone's life.